Hello, I'm Dr. Brock Rondo. I'm a general dentist from London, Ontario, Canada. I've been making oral appliances for about 15 years. But when I joined the American Academy of Dental Sleep Medicine, I realized that you don't only treat snoring, you also have to treat the apnea. And the diagnosis must be made by a medical doctor. So you need to work in conjunction with our medical colleagues. I have a 2-day course on this, and I can give you the dates at the end of this lecture. But I just want to give you a little update on what's going on, and I really feel that general dentists should get into this. It's very rewarding. I've had patients tell me that I've saved their marriages. I've had patients who are sleeping in separate bedrooms, and now they're back together again. And I've had patients tell me their blood pressure has been lowered with my treatment. All kinds, hypertension lessened, reduced the risk of heart attacks and strokes. It's very fulfilling. The other thing that's nice is that the staff do most of the work. All the tests that we do, all the diagnostic testing is all done by the staff, and that's very easy because they can do it even on your day off. If I'm traveling, they can do the records when I'm not even there. So I really highly recommend that dentists look at this seriously, not only because it's very rewarding financially, but it's very rewarding spiritually because you're really saving lives by preventing sleep apnea, and also by preventing snoring. It's a problem. As you know, snoring is a noise, a nuisance. It's bad for your relationships, but sleep apnea is very dangerous for your health. So this is a very, very interesting field to get into, and not very many dentists are doing this. I think less than 1% of the dentists are actually making snoring appliances and treating sleep apnea. So it's a field that's wide open. What I'd like to do here, you can see in the first slide, that the diagnosis is made by 3 different devices. Use a pharyngometer, which I'm going to show you later, to evaluate the size of the airway. A rhinometer is a device that's used to evaluate the nose to see if there's a blockage. And you need a home sleep study, or you need a hospital sleep study. Depending on the area you are and whether they accept home sleep studies or hospital sleep studies, it varies from state to state, province to province in Canada. The treatment is really threefold. Number 1, oral appliances, which of course dentists can fabricate. Number 2, a CPAP device, which I'll show you a picture of. And most patients don't like that. And then number 3 is surgery, and surgery is not always effective. So oral appliances is certainly what the patients like the best. You can see, if you're interested in more information on my courses, you can see the bottom of the slide there, www.rondoseminars.com for information on courses on sleep, and they start in January 2009. And if you want to look at my website for patients, go www.ortho-tmj.com and look there and to show how we try to educate patients about snoring and sleep apnea, because you definitely have to have a website nowadays. A lot of my patients find me on the web when they're searching for information on this, because an awful lot of patients are suffering from this disorder. 90 million people in North America have breathing and sleep problems. That's a lot of people in North America. That's a lot of people who have insomnia, snoring, and sleep apnea. In my opinion, sleep apnea is the most underdiagnosed condition in our society. 60% of men over 50 snore, and 40% of women over 50 snore. So that's a huge number of patients who have the problem. I really got interested 2 years ago in this. I mean, I was making oral appliances, but I wasn't into it big time like I am now. I mean, now we're seeing at least 4 new patients a week. And 4 new patients a week, and we're charging around $3,000 a patient, is you can do the math. It's significantly impacted positively in my income. And it's very easy because the staff take most of the records. I do the consultations, we make the appliance, and we put it in, and the patient's done. I'm going to show you a case, but in January of '06, the American Academy of Dental Sleep Medicine came up with the situation whereby in the medical journal Sleep, they said that oral appliances are now recommended as the first line of treatment option for patients with mild to moderate sleep apnea. So that means dentists really can get in, and what I found, treating this for the last 15 years, that most patients in a general practice are not overly obese, they're not 350 pounds, they can do very nicely with an appliance for mild to moderate sleep apnea. The severe cases need the CPAP device, which I'm going to show you shortly. That's a sample of a sleep appliance. It's a two-piece appliance. The patient can open and close, and those little wings on the side prevent the jaw from falling back, because most patients snore on their back. So when you lie on your back, the jaw falls back and blocks your airway. So obviously the way a dental appliance works, it brings the lower jaw forward, which brings the tongue forward to open up the airway. Very easy to wear. I've worn this particular appliance. I've tried 2 or 3 different ones. This is a very, very acceptable appliance and a high compliance rate with oral appliances. I know that because my patients don't come back. They don't come back because they keep wearing it. The only time they come back is if they break it or lose it or whatever, but they're a high compliance rate. They're very, very comfortable. They open up the airway and really significantly impact the health of the patients. I'll show you in a minute. Now this is the CPAP. This is a dentist who came and took my course. I have in-office courses where you can come and learn and watch me, my team and I in action, actually treating patients. And you can see Vince is certainly he's over 400 pounds. And his neck size is like 22 inches. And he's wearing the CPAP device. And what it is, it's a device that forces air up the nose. You can see on the right-hand side, he's carrying the air compressor, and he's got a humidifier there to try and moisten the air to keep his nose from drying out. But he has to go to sleep all night with an air compressing, blowing air up his nose to blow the tongue out of the way, which is that's the gold standard that the medical profession recommend for, I'm afraid, most patients. It's time for the dental profession to get serious about this and say, you know what? If a patient can't wear the CPAP, or they're a mild to moderate case, we're allowed to make them legally an oral appliance. So you need to work with pulmonologists, and you need to get a relationship established with them, and you need to work together with the medical profession. You can see at the bottom here, it says CPAP, 20% compliance after 1 year. So the medical system is being overburdened with patients going for sleep studies, and the sleep studies are very expensive, sometimes up to $1,000 to $2,000, $1,000 or $2,000, somewhere between that. And then they get the CPAP device, which costs $1,600. And then the compliance rate is 20% after 1 year. So it's costing medical insurance a lot of money for these appliances, and the patients aren't able to wear them. Now, the patients that do stick with them are a patient like Vince, because an oral appliance won't be enough for him. He's a severe apneic. He needs this appliance. And when he walks into my office, I don't make him an oral appliance. I say, Vince, you go right ahead and get that appliance, and you have to wear your CPAP. For patients who are not severe, though, oral appliances, in my opinion, are the treatment of choice. And that's exactly what the association stated in 2006, 2 years ago. Here's another appliance called the EMA, Mandibular Advancement Appliance. And that, again, a high compliance rate with these appliances. There's about 20 different appliances that I show in my courses, and I give you the pros and cons of both. But I'm just showing you a couple of appliances today that I use quite frequently. This is the deal that's important. 40 million people in the United States are suffering from sleep apnea. That's a lot of people. And what happens when you stop breathing at night, it increases your blood pressure. When your blood pressure increases, then you have a high degree of chance of getting a stroke and heart attack. Reggie White died of a heart attack. He had sleep apnea, couldn't wear a CPAP. Okay? Type 2 diabetes. All these diseases, there's a 60% correlation. A patient who has sleep apnea, there's a 60% correlation between that patient and the patient has a stroke. There's a 40% correlation between heart attacks and sleep apnea, and a high correlation between type 2 diabetes and sleep apnea. So it's a very serious condition that we can help these patients. We can improve the health of these patients. We can save lives. So it's a tremendous field to get into, and with 1% of dentists doing it, it's just wide open. So I try to encourage all the dentists to take my orthodontic courses and my TMD courses, temporomandibular joint dysfunction courses. They should also take the sleep courses, and many of them do, and have significantly helped their practice and make them feel better as a dentist. Snoring is very simple. Remember, snoring is just a noise. It's a nuisance, social nuisance. It's not a health issue. The tongue partially blocks the airway, and the tissues vibrate at the back of the throat. And usually the patient's sleeping on their back. This diagram, you can see the patient sleeping on his back, tongue falling back, and partially blocking the airway. It's not completely blocking the airway, but it's still very uncomfortable. And 50% of my patients are coming to me because their wives are upset or their spouses are upset, because sometimes the wives snore and the husbands don't, and they want something done. They want it fixed, okay? Because it's bad for your relationship with your spouse. Sleep apnea. Now, there's different types of sleep apnea. Today I'm only going to talk about obstructive sleep apnea. In the course I cover everything. And if you're interested, you can email me, and I'll send you out a course brochure or any kind of information you want. Plus, it's on my website. Just look at the website. So this is where the tongue completely blocks the airway. And the patient stops breathing for 10 seconds or more. And they'll do that several hundred times a night, where they're stopping breathing, and then they're waking up, gasping for breath. If you do this all night, you can imagine how tired you are in the morning when you wake up. You're very, very tired. So here's a photograph of the patient lying in their back and the tongue completely blocking the airway for 10 seconds or more. As soon as you obstruct the airway, the patient wakes themselves up, because otherwise they're going to die. So they have these arousals, they wake up all the time, and they don't get a good sleep. And daytime sleepiness is a serious problem. It increases the risk of highway traffic accidents and industrial accidents when patients are tired all the time. Here's some questions that you can ask your patients. And as a general dentist, you should have some forms like this that you hand out to patients. You've got lots of patients in your general practice that have these problems. You don't even have to do any external marketing. You could just hand out some of these forms and see if the patient has a problem, ask if they want something done about it, and take my 2-day course. There's other excellent courses out there, but my 2-day course will certainly give you the basics. You'll be able to treat, be able to diagnose simple cases and complex cases and know which ones you can treat. But do you snore? Are you overweight? Obviously, the more fatty tissue that goes to the neck, then it blocks the airway, the pharyngeal airway. So as we get older, men, our fat goes to our stomachs and our necks. I never had a problem until my neck was 17 inches. 16 and a half, no problem. 17 inches, I got the elbow all night. I got tired of getting the elbow, so I got an oral appliance. Now I feel much better. I'm not tired. I feel much better. Are you tired during the day? That's the #1 symptom of sleep apnea. Are you tired during the day? Okay? You should ask the patient, do you wake up refreshed? When you wake up in the morning, are you really refreshed? And most patients will say no. If they have sleep apnea, I'm definitely not refreshed. I definitely would like to stay in bed. I slept 8 or 9 hours and I'm still tired. Well, that's because they had all those arousals. Are you approaching or going through menopause? Well, women, as they get older, their fat goes from their hips to their neck, and they run into problems. So I have a lot of women in my practice too that have snoring and have sleep apnea problems and health problems. Hypertension, we mentioned that. Now the other thing is gastroesophageal reflux. Okay, GERD, when the acid comes up, and that a lot of times that is the cause of that is sleep apnea. What's the medical profession do? They give you drugs for that. So they're giving drugs for hypertension. They're giving you drugs for diabetes. They're giving you drugs for reflux. Maybe all they need to do is get an oral appliance in there and open up the airway and they can go off the drugs. I mentioned at the outset, I've had lots of patients that have gone off their medication completely when I've solved the problem. What's the cause of the problem? As dentists, we can get at the cause of the problem and solve it. You have morning headaches. Morning headaches are indicative of a patient who's bruxing all night. A lot of patients wonder, why are we always grinding our teeth? Well, you're grinding your teeth to open up your airway. So if you wake up in the morning and you have headaches, you've been grinding all night, and your master muscle and your temporalis muscle have been firing all night, of course you got headaches. So that's another sign that you've got a problem. All of these things, believe me, as a dentist, if you can help patients with these problems, you're going to be very rewarded in your profession, and you'll want to practice forever. Ran into Harold Gelb today. He's 81 years old. He's practicing temporomandibular joint dysfunction for 60 years. He still loves to go to the office. He still has a passion for dentistry. And he's one of my heroes. I'd love to practice 61 years. People say, are you crazy? Most dentists can hardly wait to retire. Not me. I really feel I'm helping patients. I want to keep going. Have you been told to stop breathing or hold your breath at night? Well, your wife would have to tell you that, or your spouse. Are you tired and irritable in the morning even though you slept through the whole night? Now, patients will tell me their heart pounds, they wake up perspiring, again, gasping for breath. Patients who are tired all the time, I mean, they lose their sex drive. This isn't good for your relationship. Do you toss and turn frequently? Do you doze off during the day? Again, I have patients I had one patient that he was driving 30 miles home at night and he'd fall asleep in the car and he's worried about it. He's an accountant. When he's working all day, no problem. When he's doing figures and on the phone and but as soon as he gets in his car and he relaxes, he falls asleep. And you have to ask the patients, when you go home at night and watch TV, do you go like that? Do you fall asleep when you're watching TV? That's not normal. You're not supposed to fall asleep when you're watching TV just before supper or right after supper. That's not normal. Again, we've talked about 40 million people have undiagnosed sleep apnea. It's the most undiagnosed condition in our society today, and it's causing a lot of problems. And cardiologists are just starting to figure that out. And there's a lot of problems with the system. There's not enough beds in hospitals to accommodate all the people. It's very expensive. In British Columbia, Canada, there's a waiting list of a year to get in. There's only 2 sleep beds in Halifax, Nova Scotia for a population of 150,000. Anyway, some centers have enough sleep centers and some don't.